Anal fissure basically is a cut wound in the anus. What does the patient feel when there is a cut? They complain of pain, occasionally maybe a drop of blood when they have a bowel movement, and usually this leads to constipation. So to start with, there is a hard bowel movement which gives the cut, then the bleeding, and in return there is a muscle spasm leading to constipation again. So we need to break this somewhere. So medications can take care of the constipation part, but the cut, we need to deal with it separately. Now this cut, usually the patients don't come to the doctor right away. So they wait, they try many kinds of pain medication, local creams available in the market, and they reach such a stage that they are in real agony, where they have reached a chronic anal fissure stage. So when do we say a fissure is acute and when do we say a fissure is chronic? We usually say that in the first 6 weeks of the injury, the fissure is still in the acute stage and can still be managed by proper medication, proper advice on the diet. After that, usually the fissures don't respond to this kind of treatment and we need to do something surgically. Now, we are using only lasers as the surgical part. So first 6 weeks, what do we do? As I said earlier, you need to have proper diet guidance, stool softeners, some sitz bath, and most of the patients, they recover from this. If the patient is still having some symptoms in spite of generously doing the advice given by the doctor, then we offer them something called as Botox injection to the anal sphincter muscle and PRP, protein rich plasma injection to the fissure itself. The Botox helps to relax the anal sphincter muscle and the PRP injection to the fissure helps heal the fissure, and the patient is usually asymptomatic in a week's time. This result lasts for about 4 to 6 months. If the patient comes back with recurrent symptoms, then he will be a candidate for a surgery. Now, if the patient comes to us late in the stage where the fissure is chronic, the edges of the wound have already been elevated, there is a small skin growth which we called as a skin tag. He is already a stage where he needs some surgical intervention. We do laser intervention for these situations where we remove the skin tag with the laser. We treat the fissure with the laser and we relax the anal sphincter also with the laser. All this procedure is done under local anesthesia and some sedation. It takes about 5 to 7 minutes for the treatment to be done. Patient goes back home on the same day and he can resume his work in a day or two. The complications of not getting treated at all is, as I said, one, there is a skin growth called a skin tag. The other more severe complication would be infection of that fissure causing an abscess and probably even a fistula. Even in this case, both these situations, the abscess as well as the fistula, can be treated at the same sitting as we are doing with the laser treatment for the anal fissure itself. The only difference will be the healing process will be a little more delayed. In spite of the delayed healing process, the patient goes back to his work in a day or two. Only the wound which is there because of the abscess or because of the fistula takes its own time to heal up completely.